afternoon to everybody. Nice to meet you again here in this webinar, okay? I was talking with Miss Dr. Velas because today here in Puerto Rico, we're having a bad weather. It's like a little storm coming over us. And we had yesterday some problems with electricity. So we hope that we don't have any kind of problem during this webinar. But just to let you know that we're going through a bad weather, okay? Well, let's start again. Okay, yesterday we made a good introduction about what was or what is, right? PFA model, who should deliver, what are the objectives, what are the core actions. We gave all that introduction initially yesterday. It was on Monday, right? That we were together. Okay, so today we're gonna start with our second model is safety and comfort. And we're gonna be talking about that a little bit. So let's go to, okay, what's the goal of this section? Is to enhance immediate and ongoing safety and provide physical and emotional comfort. So right now, you're at home. I just want you to think a little bit. Let's think about an earthquake, or let's think about a hurricane. Oh, let's believe that we are visiting a hospital where health workers are dealing with the pandemic. And let's figure out, what do you think we will see when we get to those places, okay? People will be really overwhelmed, upset sometimes. You could see people that are isolated, but the first thing PFA asks us to do is to ensure safety, and to ensure safety for us and for them, okay? So that is very important. So let's move on to our next slide, please. So right now we have a polling question for you. And the question is, given the reality of COVID-19 epidemic, select 2 strategies to provide safety and comfort to our population. A, ensuring that everything will be fine to our survivors. B, do not provide information that may worry people. C, remind people that we are all going through the same situation. D, ensure immediate physical safety. And E, provide information about disasters response activities and service. So you need to pick 2 letters. Let's see which ones are the 2 letters that you will pick up as strategies to provide safety and comfort to survivors. Let's see what our audience will say.
And for our audience, you can answer via chat and we'll share the responses with our presenters. So far, participants have selected D and E, and A and E.
Excuse me, and A, which one selected?
D and E, and also A and E.
Okay, okay. Let's talk a little bit about those answers, okay? The right answer was letter D and letter E. What about A? Somebody mentioned about ensuring that everything will be fine. And when you read about PFA, they said take special care not doing that. Why? Why should we not be ensuring that everything will be fine? You know why? Because we don't know. We don't know the future. We don't know what's going to really happen. So we should not, we're not ensure that everything will be fine. With COVID-19, I could give you some of the tools that I work out with my clients. And I always say that I don't know what's going to happen in the future, but I think that our best strategy is to focus on the present, in the present moment, in what we could do and we could handle today, because we could control our today, we could control what we do now, but really, we don't have information about what's going to happen tomorrow. So it's very important to help them to put the focus of attention in the areas that they could control. And I think that is very, very important. One of the things that we want to do is we don't want to get false expectations, okay? I said yesterday, if we don't have any information, we should not give it. If we're not sure of the information, we should not talk about that, because we might say something and something else might happen, and they will feel that they cannot trust us, they cannot trust the information that we are handling to them. Okay, so that is a very, very important point in this part of the delivery. Okay, could we move on to our next slide, please? So in this section, in the manual, you will find how to ensure immediate physical safety, how to provide information about disaster response activities and service, how to attend to physical comfort, how to promote social engagement, how to attend to children and adolescents who may be separated from their parents or caregivers, protect from additional traumatic experience and trauma reminders. For example, when we had the earthquake in Puerto Rico and the earth was still shaking, right? So we need to move people to be safe. We don't want them to have another experience, bad experience, okay? Help survivors who have missing a family member. That happened a lot in Puerto Rico when we had Hurricane Maria. People didn't know, didn't have no kind of communication with their significant other and their family. So they really need, to get connected with them and to see where were their families. The first thing you do when these disasters come by, just take the telephone and try to reach out for the people you love, and you want to make sure that they are okay, right? So we also want to help survivors when a family member or close friend has died. In COVID-19, we have a lot of bad experience. Many people have died, people of the same family, friends, and we need to help those persons to cope and to deal with what they are feeling in terms of their losses, okay? Okay, could we move to our next slide, please? I think we are. Oh,
Is this one?
let's see one before. I am not sure. Okay, yes, that's the one. You're correct. Let's go there. Next one. Okay, there we are. Okay, so what we want to do right away is to do things that are active, practical, and familiar. What had worked for people before? You should always ask that kind of question. Okay, I was very anxious in the past. When you were anxious, what kind of activity you did that helped you to calm down? We always want to see what had worked for them before, and that is very important. Today, we're trying to apply PFA to COVID-19. Safety issues are very important in the COVID-19. It is important that while you deliver PFA, you follow the current recommendations to prevent to spread the infection. So you're in the hospital giving some kind of delivering some kind of help to people. Be sure, okay, that you are wearing the personal protective equipment and that you know how to use it, and then you know when you should use it, You should always have your mask, and you also have to have the social distancing, okay, to protect others and to protect yourself. That's very important right now. Safety issue is a very big concern right now with the pandemic. A lot of people maybe wants to help people that are going to or ill, but they are really scared that they will also be infected with that infection. So people need information about how to be safe, how to keep safe. That's very, very important. We were working with the pandemic of COVID, okay? Also, another step is to get current and accurate updated information about the disaster. If we're talking today about COVID-19, um, the truth is that information about COVID-19 is changing on a daily basis. So it is very important that you as a provider, you should keep updated, okay? So you could give very good information to our survivors, okay? You should make sure also, when we're talking about safety and when we're talking about pandemic and COVID-19, one of the things that we're moving is to technology, to telehealth. So you should also be sure that the mode of communication that you are using is safe, is secure, and is easy for our survivors to manage and to handle if we are using telehealth system to deliver some kind of PFA assistant, okay? So be mindful about that, okay? Okay, let's move to our next slide, please. Our next step, our next slide. Okay, I think it was before the one before. Okay, there we are. Okay, get connected with available practical resources. One of the goals of PFA is always to link people with practical resources in their community. What's the help they could have? What are we doing? And they should have that information. Get information about responders, what responders are making to make the situation safer. Okay, there was an earthquake. What is the government? What is the community leaders? What are you working with so everybody could be safe? And you give that information to them, okay? Get connected with others who have shared similar experience. That's a very nice thing to do. Let's think about earthquake or hurricane. People are in the shelters, and maybe you want to connect each other so they could share some experience, similar experience, what they have done before and what worked for them. That would be nice, okay? And that could help also. Okay, let's move to our next slide. Today we're gonna go rapid through because there's a lot of information and I want you to have all the information for you, okay? So, and I want to apologize for my English. Sometimes I could speak very good, but sometimes it's not the same. So I think not always I could be fluent in English, but I'm trying to do my best, okay? When we're talking about physical safety, I think it's very important if you go to the field to try to look for health problems, okay? Persons, let's think that there was an earthquake and you try to see who has health problems and they need immediate help, maybe transferred to the hospital, okay? Some persons may have blood pressure issues. Sometimes if you're with a lot of anxiety, your blood pressure also is going to increase, okay? Maybe you could find elderly or other people who need some kind of equipment for oxygen. So you should be very mindful about those things who need help in terms of their health issues. And right away, try to link them with the hospital, medical, nurses, the person that could really treat them for their health issues, okay? Also, if you go to the field, you should be looking for signs of shock, okay? Some people, they are really in shock. They cannot even believe what's going on. So let's try to look for them and try to reach to that people and try to help them, okay? Some people will be in need of medication, food, water, shelter, masks, gloves, and other. So that is also very important. Even now, with the COVID-19, okay, one of the elderly, let's talk about them. Most of them need medications, and they are very afraid to go to pharmacy, okay, because of fearing to get the COVID-19 infection. So they need somebody to go to the pharmacy, take their pills, have their medication, and bring them back to them, okay? So those kind of services, we could help people, okay, in that area. They need food, some people need water. So let's see what they really need. Remember, it's always what is immediate. What's the immediate need, okay? You should also explore always if people are having some kind of suicidal thoughts or homicidal thoughts, thinking that they want to do harm to themselves or that they want to harm other people. So if you find something like that, you should immediately try to reach mental health services for those persons, okay? Don't leave the person alone. The recommendation is stay with the person until you could get the person to the service that the person needs, mental health services, for example, in that situation, okay? You should always, something else you could do for people to help them be safe is to contact relatives, okay? Sometimes they are alone, the elderly is alone, but you could call maybe a daughter or a father, mother, somebody in the family that could take care of this person, and you could link the person to other family members that will be with them and will try to keep them safe, okay? And make sure that authorities are aware of any daily needs that are not being met for the persons in the field that you're dealing with, okay? Make contact with people. They need help. They need somebody to go over tomorrow to their house and look out for their blood pressure again. That's kind of things, okay? So take that with you. Okay, let's keep on moving, please. Providing information about disasters, response activities, and services. That was one right in the poll question, and that's correct, okay? If you want to be people become, you need to give information, information helps people to move from uncertainty, and that is a very good strategy. So to help reorient and comfort survivors, provide information about what to do next, what is being done to assist them. There's water coming. There's a bus that is coming to take you to the shelter, okay? You should also be you should also have information about the service, what other service you could link the person. Also, we will be talking today about common stress reaction. Many of them will be very upset, and they think something wrong is going on with me because they are having very strong emotional reactions, and you need to let them know that these reactions are normal in the situation that they are going through, okay? Other kind of information that you could provide to survivors has to do with self-care. How do you take care of yourself? You know what? Let's talk about COVID-19, okay? I have been working a lot in delivering fatigue for compassion for fatigue webinars and helping people to acknowledge the importance of self-care. If you want to have a good immune system right now, you should manage stress. That would help a lot. So when disasters occurred, people usually get out of their routines, they don't sleep too well, and we need to give information to them that self-care is very important, okay, for them and their family members. So take that be mindful about that, okay? Answer pressing question and support adaptive coping, okay? Most of them, they have a lot of questions. So maybe you could be there, hear about what's the question, what's the concern, and just answer for them, clarify their concern. That will help a lot, okay? And always remember to be a good communicator and also to be a good listener when you are providing PFA services, okay? Use a clear and concise language and avoid technical jargon that they will not understand. If you're talking with children, you should talk with words that children could understand, okay? So it's very important that you watch what kind of words you're using, how is your language, could they understand what you are saying, okay? And so there will be no misunderstood on it, okay? Let's move on to our next slide, please. Okay, strategies for providers in order to help survivors when a family member or close friend has died. Today in COVID-19, that is a need, okay? A lot of people has lost a family member, as I said before, and they will need you to help them. In the manual, you will find handouts, okay, that they give you some recommendations, specific recommendations, how you could deal with them and how you could help them go through. In today's presentation, you will see a video, and in that video, I would love you to be aware how in brief, maybe 5 minutes, 10 minutes, the FPA provider made a very good intervention with this man who has lost his wife, okay? And we'll talk about that a little bit later, okay? Sometimes survivors have a missing member in their family. So their prior need in that moment is to help them get in touch with their family member that is missing. Attend to children who are separated from the parents or caregiver. Protect from additional traumatic experience and trauma reminders. And we'll talk about trauma reminders later. So remember, in the PFA operational guide, you will have all the strategies that you need, okay, in order to give that information, to give recommendations in these cases to your survivors. Okay, let's move on. Dr. Velas. Can hear you.
You're muted, Isa.
Okay.
Okay, sorry. I was saying that sometimes a little bit difficult doing both things at the same time, but we are here. And as I want to remind you all that the PDF handout and the guide is there on the handouts box. So you can download it and you can have it, okay? Is my sound okay? Just want to make sure.
Yes, we can hear you.
Okay. So as Dr. Gonzalez, she was speaking, these factors that I will be presenting here, I think are specific factors that we need to take into consideration while we're providing services to our Hispanic or Latinx community. And it's like to understand that people from different parts of Latin America, they experience different immigration patterns, right? We can observe that people coming from Central America, and I will say specifically from El Salvador, where there's a wars and gangas there. So we can provide the PFA to some people that could present a lot of mistrust. Like they don't trust providers, they don't trust the systems, they don't trust um, mental health providers, right? Because sometimes their trauma experiences impact the way that how they relate to other people around them. So this is something that we need to take into consideration. And also, Puerto Rican and Mexican American children could be like present lower educational or economic resources. This is specifically because Mexican and Puerto Ricans are the United States has a lot of Mexican and Puerto Ricans in the United States. So are the immigrants with higher population in the United States. So we can observe this. Also, immigrants who have arrived recently, they will present different stressors than people that used to live in the United States for a long time. And because sometimes when they arrive, they don't know how to speak in English, and mostly they have difficulties calling for services or requesting help. So I think these factors, we need to take them in consideration while we're providing the PFA. So the next slide, also explain about other type of factors that we need to take consideration. I just want to share with you one experience that I had with a 9-year-old client and his family. And it was related that his mom was arrested before he was deported because she was from Mexico and she tried to go to California because she has her family there. So my client, he was really scared about let's see, going to a new agency or even starting services because he was thinking that his mom could be deported. So I think this is something that happens to a lot of people from Central America and also South America. So this is a factor also that could increase the disparities in mental health services in our Latinx communities. So now we're gonna show you a video. You wanna?
Okay.
Okay.
Okay, thank you, Dr. Velez. Okay, so now we would like to present a video, okay? The following is an example of a brief support educational intervention taking place in a family center shortly after a bomb. And the man has lost his wife and he has 2 children. He's overwhelmed with all the details and in dealing with the death of his wife, and the family is really very worried because they don't see that this man could express his emotion following the loss of his wife. Okay, so we will have the opportunity to see a PFA provider dealing with this man and how they normalize, provide support, how the provider also give him information about hotlines and other services that he could link to later on. So I will not tell you too much about it. Let's see the video and then we'll talk about it. Okay, let's go to the video, please.
over and over in families. People don't always realize what's going on with other people. And I can tell you that from what I know about a traumatic death like this, what you're going through right now is really the big stuff. You know, first things first, you've got to take care of the details right now, get things in order and on and on. So you're really on track.
Well, that's good to know. Maybe I can tell my family that they'll back off. I know I've got to take care of business and all, but just between me and you, in some ways, I wonder if my family's right. When I'm alone at night, I expect to feel something, but I just feel numb. It's the strangest thing. I mean, I love my wife a lot. Why am I not crying? I feel so guilty.
You know, everyone in every situation is really unique. But I can tell you what I know about trauma, that when someone dies like this in a sudden and unexpected way, it's really common for a spouse to feel.
So I'm not crazy.
No, not at all. It's really common to feel numb. That's what comes first before the grief in a lot of ways.
That's so true. Right. I'm just in shock. It's just too much. I can't believe it happened.
I know. Just remember that you might not cry now. You might not cry at the funeral. You might not cry until much later. But focus on the shock of the death can take over for a while until it sinks in. It's really common for it to delay or interfere with grieving. So it's important not to also feel bad about yourself on top of all that, for not feeling something like what you and your family would expect. Instead, just let it be. Just let your reactions follow at their own pace, you know?
That's really good to know. I'm actually hear that. I just never thought about it that way. No one in my life has ever died like this. So one of us will find out. I'll have to tell my family this.
I think that's a really good idea. And from what you've said, I know none of this makes it any easier to be a parent either.
Yeah, I know. What can I do? I'm not sure how to handle this.
You know you've got time to deal with that. For now, you have a lot to handle. Each of you will have your own way of handling this and dealing with it.
You know, it's really true. We all have our own personalities. It's amazing to be related.
Yeah, and that has to be appreciated and respected. You can just set up an attitude of understand each other. You're doing really well. If you're having a hard time, you can tell them something like, I'm not doing so well, but in a few months I'll feel better. But we don't need to go into that now. You can talk about that later on and less pressure.
Okay.
I don't want to leave you in the middle of it. If you want to take more time later, you can choose the right place and time. I'll be here from 10 until 6 for another 2 weeks. And I can also give you a card with a website address and an 800 number for you to call if you have any questions, if you want to talk about anything.
Thanks. That would be great.
Someone will always be at that number whenever you want. There's some good people down there who can talk with you about yourself, your kids, you name it. You know, none of us are experts on how to handle a shock like this in our lives. And sometimes it's helpful just to bounce your thoughts off to someone else who's familiar with this.
No, it's really been good to talk with you. Very helpful.
No problem. You just keep taking care of yourself. Please feel free to call if you ever need anything.
Thanks.
Okay, people hears me? Yes. Okay, so in this very short video, I'm not sure if the you could hear pretty good, but it's very short and you see most of the principles of PFA. Okay, you saw how fast the counselor could access Eric's basic need. Okay, and the counselor tried to focus the conversation quickly to access how she can be or assist this guy. Okay, it was very short. Okay, as I said before, you're not going to do a psychosocial history before or during your intervention with a survivor. You just go to see what's the need, okay? And that's what she did in this video, okay? Also, you saw in the video how the counselor or the PFA provider provide validation, support, and normalization, okay? She said, you know, it's very normal for people who has to go through the experience of a loved one that has died to get numb. And you know, when he hear about that, oh, it's okay, I'm not crazy, okay? It's a normal reaction. Not everybody gonna make touch with their feelings. Some people will just get numb, will get in automatic pilot. They will start working with all the papers and all the things that has to be done when somebody dies, and they may not be in touch with their feelings, okay? And she also gave him some psychoeducation, very brief psychoeducation about traumatic grief, okay? And that is very important. You know what? When I said very little psychoeducation, because people are overwhelmed, and you don't want to overwhelm the survivor with too much information that in that moment the person will not be able to handle all the information that you are giving to them. So try to keep it simple, short, and precise what the people need, okay? So the other thing that I think was very good was that she gave him provider follow-up and referral information where he could look for help in the future, because she knew that right away the person maybe would not be able to access psychological service or some other kind of help if he needed, but maybe in the future this man could want some kind of information or help, and she gave him some information where to look at it and where to get the help, okay? So that is very important. Maybe immediately people will not be able to move to look for other resources or services, but maybe in the future, yes, they will do that. And if you give them the information, they will have it already, and that will be super, super, super for them, okay? So, okay, I hope you enjoy the video and see that in a very short period of time, you could do a lot helping survivors to manage their needs and concerns, okay? So let's go to our third session of the model, okay? We'll talk about stabilization, and the question may be, who need stabilization, okay? And most individuals affected by a disaster or the pandemic will not require stabilization, and that's very, very important. Expressions of strong emotions, even muted emotions, for example, numbness, indifference, people may be spaced out or confused, are expected and are normal, okay? I could give example of maybe my own family. I think that when the first 2 weeks of the lockdown with the pandemic, families were very afraid, very, very, very afraid, and they were extreme in the measures to protect themselves and be safe. Later on, you know, I think the time people have internalized a little bit what's going on, and then everything was going back to normal. For those first 1 or 2 weeks, people were very, very afraid, okay? If they have to go to a supermarket, they will be very anxious. Now, the question that you may have over there at home is, hey, Dr. Gonzalez, and how could I know when it's needed, the stabilization, and when not? And I'm going to tell you something. I said before that all of these strong reactions are normal. But when a person should begin to take action on these strong emotions, I'm going to give you cues, okay? Number one, if the strong reactions they are having persist too long, more than 2 weeks having the same responses and not could manage that, okay. And the other point that you should be mindful at is if the strong reactions or emotions that the person is having is interfering with their functioning, social functioning. Let's believe there is a mom or dad, and they are so anxious or maybe so spaced out or some they could not take care of their children. That's a big problem. So that kind of people, we want to help them, and they need stabilization so they could go back to their routines, and they could go back to their roles, basic roles, and they could function in a good way, okay? So I think that's the 2 points that I want to make clear. Number one, how long, how much that prolongs, okay? It's about more than 2 weeks, okay? And the person have the same strong reaction, and is that reaction interfering with their daily functioning roles? And then we should take care of them, okay? So I want to make that point out for you. I think it's very, very important. So in this section, we're going to be talking about how to stabilize emotional overwhelm survivors, how you will be, give them orientation so they could know what they could do, okay, to calm themselves. And in this section, we will talk also about what PFA thinks about the role of medication, okay? So let's talk about a little bit. Let's go up now to our next slide. Okay, so you go to the field, the disaster has happened, and you go to the field. What do you want to do? You want to observe individuals disoriented or overwhelmed. Look to glassy eyes, back and unable to find direction, unresponsiveness to verbal questions or commands, people who are disoriented, okay? Do they know who they are? Do they know where they are in that moment, who they are? Those are questions that we usually make in the field, okay? And what person are exhibiting strong emotional responses, uncontrollable crying, hyperventilating, rocking this way, right? Or regressive behaviors, usually in children. But I want to make a point right here. And the point is that not everybody, that you could see people that need stabilization that not necessarily are crying, or they are having this hyperventilating, or they are having weird behaviors, you know, because some persons, they could just not express themselves, you know, they're so shocked in the experience. So I think that you should always reach the person and ask, is something going on? Would I help you? Okay. And try to see if the person really needs something or needs stabilization, or if the person doesn't need it. You know, not everybody that is crying needs stabilization. Okay. Maybe somebody won't cry, and maybe the best thing that people will do is cry in crisis without intervention. But if they don't cry, that doesn't mean that doesn't need help. So take that in consideration also when you're delivering PFA. Okay, let's move to our next slide, please. You would also be observing, okay, shaking, trembling, exhibiting frantic searching behavior. There's a lot of worry, but people could not manage, okay, their worriness, okay, and if they're engaging in risky activities. When you go to literature, the literature will say that adolescents usually will involve in risky activities. So those adolescents that are engaging in risky activities may need help, okay? So take it in consideration also. Okay, let's move to our next slide. Okay, interventions and emotionally overwhelmed survivor. Use this point to help survivor understand their reaction. Orient about shocking experience that might trigger strong, often upsetting, alarm reactions in the body. Intense emotion. I don't know. I forget everything. I don't remember what happened. You know, it's okay. That usually happens. If you were experiencing a disaster, a trauma, something that was very difficult, you were in the hospital with a family member with a COVID-19, and maybe you don't remember anything, or maybe you lost your keys, or you don't know where you left the car, you know, and it's not that something wrong is going on. It's very normal response when we're dealing with this kind of events in our life. So if you give orientation to the survivor, he could understand what he is going through, and that would help a lot, okay? Offer support and help, focus on a specific manageable feelings, thoughts, and goals. People sometimes are worried and they want to resolve a lot of things at the same time. You cannot do that. You cannot resolve so many things at the same time. Just pick one. Pick the big priority. What's the most important thing to do right away? And let's work with that in that moment, okay? Address the primary immediate concern or difficulty rather than simply trying to convince the person to calm down or to feel safe, you know? Sometimes, and this bullet, I think is very important for you to pick up, okay? Sometimes we want to help and we just will go to the survivor. Oh, but you need to calm down, but you need to calm down. You know, that won't function. It's not a good idea, okay? The best way to calm down people, I like to model myself that I am in calm. And that there's something up here that's called neurons mirror. If you're calm, try that their neurons, okay, image models yours, okay? So don't you get upset with the client. Try to model to be calm, and that's okay, okay? But try to see what's the concern. That's what the last bullet is telling us, okay? What is the immediate concern or difficulty? Don't tell them they have to right away calm down and feel better. I know you're upset. What do you need right now? And let's move. Let's get that done, okay? And that's the point right there. Okay, let's move to our next one. Okay, so also one of the things that you will find in the manual are instructions for breathing exercise that will help people to calm down. Try to see what had worked for them before. Okay, maybe they use some kind of meditation. Well, let's do some kind of meditation. If you have the experience before and that helped you, let's do it. Sometimes with children and with adolescents, something that will calm adolescent is to get near another peer. So let's try to find the best friend and put them together, okay? That will usually help with adolescent so they could feel more safe, okay, and calm. That's a very good experience, okay? Some of our persons, especially if you find out that they are losing touch with here and now, you could use some grounding exercise, you know, and people will go and I will bring them back. Okay, name 3 objects around. What do you see right now in this environment? I see the chair, I see the sun, I see a car. Okay, try to bring them back. So that's when we do grounding exercise. Grounding exercise can be used also with children, okay? With a little bit of twist in the instructions. For example, you could say, let's name colors. I want you to name 5 colors you could see around in your surroundings right now, okay? And the child will start, okay, I see blue, yellow, orange, and that's the way you could do grounding. So if you feel that you want to do it, you will have in your manual the instructions how to use grounding exercise with adults, how to use grounding exercise with adolescents, and how to use grounding exercise with children. It's all there for you, okay? Also, another very good strategy is to find friends and family that are very important resources to help and calm down people. Okay, maybe you could say let's ask for the best friend, or maybe daddy could come by and be with you and calm the child. Okay, or the best friend of mom could come in, or maybe an adult could talk with his mother and that would calm him. So try to connect people, okay? They have been from support for them in the past, and that would also help a lot. And if none of these interventions aid in emotional stabilization, consult with medical or mental health professional. If you see that persons persist prolong in being emotionally overwhelmed, and then you could decide to link the person with a mental health professional, and I think that would help a lot. Okay, let's continue.
Dr. Gonzalez, I will add to that that sometimes like just taking a deep breath, it will help the person a lot just to calm herself and be a little bit more relaxed, because usually when we are really overwhelmed, our automatic system is start like our heart start pounding, our breathing is like shorter, and we're like this. So just letting them know, breathe in 4 seconds, and then breathe out in 4 seconds, and that will help a lot.
Yeah, yeah. And with children's also, you could teach children's how to breathe, right? And you have some videos in the page where you could say, let's teach how you inhale and what's your best your favorite color, and the children may say pink. Okay, well, let's inhale pink and let's exhale gray, you know, and they will learn how to do that, and it's very cool and will help a lot. Really, it will help a lot, you know. What people most need when they're anxious is to breathe. Okay, so that's very important. The role of medication in stabilization. Okay, medication for acute traumatic stress reaction is not recommended as a routine way of meeting the goals of PFA. We had said before that these are normal reactions. We are not talking about psychopathology. So we know that people will overcome them with support. That's what they really need in that moment, okay? If the thing, if that you have to refer them to mental health, then the psychiatrists will decide if he has to need, the person needs some kind of medication, but usually they will not need medication. Okay, and that's very important. When somebody dies, or people usually try to give pills to people because they are crying. People need to cry. It's okay to cry. There's nothing wrong with that. Okay, let them cry if somebody died. It's a very good way to express their emotion. There's nothing bad with that. So let's not try to use medication in those moments. I think that's very important. But also, I have to responsibly say that some of our survivors already have mental health issues, and they drink pills, medications for their mental health disorder. If that is the case, the person must continue with the medication he was having before the disaster. Okay, so that's a parenthesis. It's important. If the person was already in medication, they should keep on with the medication that were prescribed before. Okay, and sometimes in crisis interventions, or after a disaster, some people will maybe need some kind of medication, but usually it's for a time limit. Doesn't mean that forever they will be then needing medication. That's not the truth, okay? So just to let you know about that. Okay, let's move to our next slide, please.
Thank you. And Dr. Velez, there was some sound issue when you were responding earlier. So if our participants would like to know if you could readdress that.
Oh, sorry. I was saying that when I was talking about the breathing, that
Mhm.
Okay, so that I usually try to recommend to my clients to take a deep breath. And sometimes it will help the person just to be a little bit more relaxed. And usually I just let them know, let's do this in 4 seconds. Like you're gonna breathe in for 4 seconds, you're gonna hold your breath for 4 seconds, and you're gonna breathe out through your mouth in 4 seconds, and you're gonna be without air, right, in 4 seconds, and then repeat it again. So I think that's really simple and will help everyone to just calm down a little bit and to think more clearly. And also, what they're gonna understand everything that you're explaining to them, because usually when people are with their alarm system on, it's difficult to process what you're saying. It is difficult to remember also what other people are saying. So it will help our mind and the person that you're providing the PFA just to calm
Mhm. Yeah, thank
Thank
you.
you.
down.
Thank
Okay.
you. Okay, so if we keep talking about the role of medication stabilization, exposure to disaster may worsen on pre-existing condition. So if you already had an anxiety disorder, for example, and you went through COVID or you're through an earthquake or a hurricane, well, usually those pre-existing conditions can get worse, right? So they may need continue with their medication, as I said before. Some survivors may be without their medication. That happens a lot in Puerto Rico. When we had the Hurricane Maria, pharmacies were closed, okay, and people didn't have their medication. So it was really an emergency to try to find out all this medication for these people. How do we get to the insurance plan, and how we go to the pharmacy to get the prescribed medication for our people. That was very, very important action to take and to do, okay, to be worried about how our mental health patients had their medication, the medication that they really need, okay? And usually when disasters go by, as Hurricane Maria and the earthquake, communication with their physicians, their psychiatrists sometimes is difficult because offices are closed. So most of our people will need help from providers to link them again, okay, to their mental health providers or to the medical doctors that they were in follow-up, and that's very important that we could do that for them, okay? So let's move on, please.
Mhm. Dr. Gonzalez, and also talking about going to the psychiatrist or going to a psychologist. I know that for our Latino community, or Latinx, it's difficult just to go straight away to a psychiatrist or a psychologist, right? Because the stigma about mental health. So one of the things that we as a Latino we can do, and you as a provider of PFA, is just like if the person is presenting just like Dr. Gonzalez mentioned, like disoriented, the person is not sleeping, right? For me, a red flag is that the person is not sleeping at all, because they're not going to be concentrated, they're going to have difficulties with attention, they're going to have difficulties with anger, right? So if the client or the person is feeling that way or experiencing that, um, you can let her know at first, like, you know what, I think it would be good if you could go to your doctor, to your medical doctor, your primary care physician, just to check if you're okay, just to check how your body is working, because the physician, it's more easy to Latinos to go to a physician than to go directly to a psychiatrist. So you will help that person to start going into treatment, just to let them know to do a checkup with your medical doctor. And I would say that family is crucial in that process of stabilization. La familia viene primero, ¿verdad? In our Latin culture, familia is everything, goes first, right? And usually you have people that they are surrounded by la hija, la abuelita, the uncles or grandmas that are there for them. So if the person feels comfortable, maybe when like the interview or talking to the person with another family member, so that person could feel more calm or more relaxed and more engaged with you. So this is some of the recommendations that I would add to this part.
Okay. Okay. So let's move to our fourth section, okay, in PFA manual is information gathering, need, and current concern. And the goal of this section is to help you make the assessment, a rapid assessment to identify the immediate needs and concern, gather additional information, and tailor psychological first aid intervention. So you're going to be connecting, okay? This is the need, this is the concern people has, and then what PFA intervention could I deliver that will help people manage their need or their current concern, okay? Let's move on to our next, okay. So in this session, we want to go and see what is the immediate need the person has. You have to be flexible, adapt intervention for a specific individual's need and concern, gather enough information so you could tailor and prioritize your intervention to meet these people's needs, okay? Your ability to gather information will be time limit. You don't have too much time, okay? Maybe you don't have too much time, but there are other factors around that doesn't help neither. Too much people around, going on, too much things going on. Maybe you don't have all the time neither. So you need to be very, very focused on what do you need? That's the question. Most of the time, I'm going to tell you what's the challenge for you as a provider when you're gathering information. People want maybe to talk, and they will want to talk to you a lot of information. And I was at home with the hurricane coming and the winds and my neighbor, and they will start trying to give you too much information. Okay, what's the problem with that? Then maybe people could talk about a lot of things, but you didn't get focused to see what specifically the person need in that moment and what you could provide to them that it would be useful. So that is the reason why PFA stress out a lot, that you should go right to the point. What's the problem? You know what? When we're dealing with this kind of emergencies, try to avoid so much details. You know why? Because people get very emotional. And as I said before, PFA providers are not necessarily a mental health professional, and there may come some information that you may not know how to deal with it. Okay, you need some kind of information. Let's make an example. Let's take an example. Let's imagine that we're working with somebody that has to do with the pandemic, and you want to need some information about. So what kind of information may be necessary for us to know? Is the person infected with COVID-19? Is somebody near them, a family member or friend, infected with COVID-19? Did somebody die? So you try to get the information that really helps you understand what the person is going through in that moment. That is precisely the information that you want to look for. If it was an earthquake, were you at home? Did you were hurt? Somebody you love get hurt, to try to see what's the immediate need that people has, okay? So I think that is very, very important. So as I said before, formal assessment is not appropriate in PFA, okay? It's not appropriate. You just go and look for the information you need to help the person. That's it, nothing else, okay? Sometimes And you have to be very empathic when you're doing this, because some people, they really want to talk and they will talk a lot. So you could tell them that it's very interesting, their story, that you would love to hear the story if you have time, but right now is a limit of time and you want to be really helpful. So how could you help him? What's the need? Okay? And maybe sometime later you could refer the person to a counselor or something like that. It could people keep talking about their experience during the disaster. Okay, so I hope I have made my point out in the situation. Okay, let's go to our next slide. One other thing that you want to do when you're in the information gathering is that you want to access if the person needs some referrals. What kind of referrals people may be needing during a disaster, okay? Is the person having some problem in substance abuse? Do you need to refer them to a substance abuse program? Do you need to refer them to other disaster agencies so the person could get help? Other community service? Is the person a mental health survivor and he needs some kind of help in that area, and you need to connect them for medication or for keep on their following up session with their therapist? You could do that, okay? Sometimes people will tell you that what they need is to connect with their religious community, with their religious leaders. So if that's what they need, we will look for them so they could talk with it. Right now in COVID-19, a lot of people that is going through death and seeing people they love death, they would like to sometimes talk with community religious leaders, and that is okay. You could try to arrange the connection and so they could have it. In other cases, what the people will need is a medical treatment, so we'll link them there, okay? So what you do when you are delivering PFA is that you make a referral, and sometimes we have papers that we could say if the person accept the referral, if he said yes, or if he declined and he said no, I don't want to go there, and he said no, just write it down so you have that information clear, okay? That you offered the service, but the person did not accept it. Okay, that's very important also. So let's move to our next slide.
I just want to say that sometimes also on the communities of faith-based or churches, they also have sometimes mental health services. So I think that also it could be like a good connection.
Yeah, I would also say that if you go to PFA, PFA have a special manual for spiritual leaders and for church communities. So they could go and get the manual how a religious community could deliver PFA to the person with it that they serve. Okay, so it's exclusively for religious community, and you will see that manual also. Okay, it exists, so look for it. Okay, okay, we have another polling question now, number 2. Faced with the reality of COVID-19 pandemic, some people need concerns are related to A, death of a family member or friend, B, thoughts of harming self or others, C, concerns about loved ones, D, all the above. So let's go right away to our polling and choose your letter.
And again, I'll remind the audience to use the chat box for your answers. Okay, so 100% are saying letter D.
Oh, you're great. That's totally correct. Yeah, great, great. That's totally correct, right? In COVID-19, there's people dealing with the death of a family member or friend. There is a lot of intrusive thoughts also in terms of safety of others. I went to the supermarket and then I went to visit my mom, and I'm so worried that I might have the COVID and that my mother is now going to be in risk of having the COVID-19. I have heard everything. I've been hearing people having issues, sexual issues. I had a sexual relation yesterday night, and now I am very worried. I need to have my COVID test done because I don't know if I had COVID, and the anxiety level will rise. Okay. So yeah, people are having a lot of those concerns, and a lot of people having intrusive thoughts that they are having COVID-19, and they are looking desperately to get a COVID test. And right now, people, they're not so much available right now in Puerto Rico. So that is very difficult. If they need to have the test just to lower a little bit those intrusive thoughts, it's very difficult for them. So yes, that's the truth. That's what's going on with COVID-19. Okay, let's keep on, please. Information gathering, okay? So in this gathering of information, as I said before, you want to know if persons, the concerns people are having, especially in COVID-19, with the safety of loved ones. You want to know about the death and family members, concerns about going threats, physical and mental illness and medication, disaster-related losses. You know what? Right now, you could talk about COVID and you say, yeah, people are very afraid of, but there are also in the literature what we call secondary stressors. And the secondary stressors is, how many people lost their jobs and they are dealing right now with not having a job? You know how many people are dealing with financial issues in commercials, stores? People could not handle anymore their business and they think they were lost everything. So it's not only about having COVID that is like a primary concern. It's about all the secondary stressors that came with the COVID. Okay, financial issues. Children could not see their friends. They're no more at school. Disruption in the whole educational system. That's a very big stressor for their mom and dad as for children and adolescents. Okay, that they could not be in touch no more with their friends. That's a very big issue, and that's also a loss. So it's a lot of losses going around people. Okay, you have lost your routine, your daily routine. You had a routine before COVID-19 came in. Okay, since we have the pandemic, people's routine has changed 100%. Okay, and that's very difficult for them. So we need to address that. Okay, we also need to address all those secondary issues that are going on. And some people may feel guilt or shame also. I had this phone call once from this client, and she was really feeling a lot of guilt because she said that she has everything. She's not sick. Nobody in her family is sick, but she has a lot of stressors. She has 3 children. She has to do homeschooling. She has to work from at home, and she needs to fix up her house and daily cleaning and cook for the children and do a lot of things she never done before because she used to work out, and there was another person, and she was so stressed. But she was feeling so guilt because she was so stressed and she was irritable and she was fighting with her husband and with the children, and she could not believe why she was doing that, but she was doing it. So just telling this a lady that it was normal, that she was having a lot of stresses over her, okay, shoulders, and that she also need to work with how to take care of herself emotionally and how to work with all those stressors, and that she could be thanks to God that she was not sick, but it was totally normal to be upset because she had all these secondary stressors she was managing at the same time. So that is good intervention, and we need to tell them those kind of things. Okay, let's move on, please.
Dr. Gonzalez, well, another of the feelings that I observed through my clients.
Okay, we have Dr. Willis Freeze. Okay,
see.
so I'm gonna.
Yeah.
Dr. Velez is writing me that she has problem with
Her
that.
power's out. Her
Yeah,
power's
power's
out. So I think we can continue and she can
Yes,
rejoin us. Okay.
yes. Could you move for the next slide, please?
Let me make myself the presenter and I'll do that right away.
Okay. Okay, let's keep on of time. She will reach me later, okay? Other information gathering should be around issues of alcohol use. Literature will tell us that when disasters happen, people will increase their alcohol and use and drug use, okay? So we need to look for information if the person has an alcohol or drug problem and what they need to address in terms of they may not have a problem, but they may start using a lot of alcohol or drug, and that will bring other problems to that person's life. So we need to talk about that in the manual. You will have a paper handout that would give you a lot of information, how you could orient survivors who are having that kind of problem, okay? And other things that people may be in need is, as I said before, also religious or in a spiritual need. As I told on Monday, my mother is just telling me that she really needs to connect with her religious community and that she's missing that a lot. She said that's number one missing for her right now. So we need to be sure that if that is the need, how we could connect the people to their religious community again, okay? So I'm gonna keep moving later on. Okay, in the manual, you will find also sometimes a provider's alert, okay? And in this case, one of the alerts that the manual will bring you is to clarify disaster-related traumatic experience. Avoid asking in-depth descriptions of what may provoke additional distress. Okay, so that is very important. And I will repeat that, okay? Avoid asking for in-depth descriptions that may provoke additional distress in the person that you're working with, okay? Don't press survivors to disclose details of any trauma or losses, okay? If they are anxious to talk about their experience, politely and respectfully tell them that what would be best helpful now is to get some basic information so that you could help them in their current need and plan for the future, maybe another meeting where you could hear a little bit more about their story, okay? And let them know that there will be more opportunity to talk about that experience in the future. I think that would be very important in those cases. Okay, in the next slide, you will see survivors' current need. That is a handout that you will have in their appendix D of the manual. In that handout, you will have a column that is about behavioral need, extreme disorientation, excessive drug or alcohol problems. The person is withdrawal or isolated, high-risk behaviors. The person is showing regressive behaviors, separation anxiety, violent behavior, maladaptive coping strategies, and you will mark, okay, a check mark on that handout. So you could have evidence of the need, the people in the information gathering, what need did you assess in your evaluation, okay? People may have not maybe behavioral needs, but have emotional acute stress reaction. Maybe the person is in an acute grief reaction. Maybe he's showing a lot of anger or irritability, feeling anxious or fearful, despair, hopelessness, feeling guilt or shame, feeling emotionally numb. Whatever you find out, you just make a mark, okay, in the sheet. They may have somatizations. Yes, people that are going through disasters. And right now, I could tell you, okay, I started, wow, we have a strong wind right now in Puerto Rico. I told you we're having a bad weather. And in earthquake in Maria and in COVID-19, I've seen a lot of people that the major concern is that they are having physical problems. Sometimes there you will see somatization, okay? Headaches, stomachache, really problems with sleeping, okay? Sleeping difficulties, eating difficulties, chronic agitation. They feel tired all the time. Yeah, that could be, they could be making some somatization, their emotion, you know, they're not dealing directly with them, but then they can express what they are feeling through physical symptoms. And you could find out when you're working with disaster survivors, okay? And sometimes you will find out needs that has to do with the cognitive domain, inability to accept the death of someone, a lot of distressing thoughts, dreams, nightmares. People, it's normal that people have difficulties to concentrate and to remember things. They also could be very worried and have a lot of preoccupations dealing with death and destruction. Totally, totally normal. And you could find all those kind of things when you do the information gathering, okay? And you also should know, okay, that past experiences of a psychological trauma uh, is a factor that could make more difficult for people, okay, to go through the experience of disaster because they have previous emotional trauma. So that could make it difficult for people. It's not the same people that have gone through a lot of losses and they have another one, that a person that has not been or does not have an history of a lot of losses in their life, okay? It's not the same thing, and you should be mindful about those kind of things also, okay? Sometimes what you find in people is a lot of financial concerns or problems. We could deal with that to see how could we link with some community service that may help them to deal with that. You know what, in Maria, in the hurricane, one of the big concerns of a lot of people, they lost their pet. And that was a really big concern also, okay? Sometimes as it happened to us with the earthquake, people will be in need of living arrangement and they may need you unlink them with that kind of services. Right now in COVID, people has lost their job or schools, okay? And those are all the concerns that maybe you will find out when you go to the field and you work with the people, okay? So it's also, and one of the recommendations of the manual of PFA is that
Excuse me, Doctor. Excuse me, Dr. Gonzalez. We have the presentation. Which slide are we on right now? So that we can
let
show to the
me
audience.
see if I could help you with that. Let's see, because I can see here right now which one. Okay, I'm not yet in practical assistant.
Okay, so
Yeah, check the box. Okay, that one. Okay, the next one. Next one.
mm,
That's it.
that's it?
Yep.
Okay, perfect. Thank you.
Thank you. Thank you.
Okay.
Okay. So I was letting you know, right, that a very good question is there anything else we have not covered that you are concerned about and you want to share with me? That's a very, very good question. And I want all of you to take the question with you so you could see that maybe we have asked about job concerns or food or living arrangement, but they may have another concern that we haven't asked for. So we always should make that question, and that will help a lot. Okay, let's move to our next slide. Okay, let me see if I could help in the next slide. Is about cultural alert and common mental health disorders among Hispanic and Latinos. And Dr. Isa Velez has there this generalized anxiety disorder, depressive disorder, post-traumatic. I was sharing with you on Monday that usually we think that after a disaster, what we will have usually more is post-traumatic stress disorder, but really what we usually see is more generalized anxiety disorders and depressive disorder. We also be very mindful to substance use disorder. It goes up, it increases a lot sometimes in our families, okay? And Dr. Isabelles was sharing for us in the slide that also Latina high school girls have a high rate of suicide attempts. So take that in consideration, okay? Let's move to our next slide, please. According to the 217 Youth Risk Behavior Surveillance Survey, which was administered by the Center of Disease Control and Prevention to people ages from 10 to 24 years old, 1 out of 10 Latinas has attempted suicide in the past year. 2 out of 10 have made a suicide plan, have had said they felt hopeless, and rates of depression, suicide thoughts, suicidal attempts have remained above Latino male youth and white males and females. So that information is good for you to have it. So let's keep on and let's move to our 5th section. Okay, and I think I should go a little bit more rapid to cover more information. Okay, practical assistance. When you know the need, what we have to do, we have to move right away to try to see what we could do or what the people should do to help themselves in the situation they are going on. So the goal is to provide, okay, that practical help to survivors in addressing their immediate need. We're going to identify the most immediate need, clarify the need, discuss an action plan. That's very important. How we're gonna resolve the problem, right? Act to address that need and offer practical assistance also to children and adolescents when we have access their needs and concerns also. Let's move to our next slide. And our next slide will give us information that exposures to disaster and post-event adversity is often accompanied by a loss of hope. And we need to address that issue. Could you move to our next slide, please? Okay, those who are likely to have more favorable outcomes are those who maintain hope and restore dignity. So in your intervention, okay, try to be optimistic. Try to build confidence in that survivor. Believe that things that will work out as well as can reasonably be expected. Believe that outside resources act benevolent, that they're going to help. That will help people to get through the disaster more rapidly and cope with a good coping mechanism. Strong faith-based belief usually will help a lot. Positive belief. Right now, I am using from the SPR model more than positive belief. My recommendation is to use helpful belief. Okay, thinking that I'm gonna have COVID-19 is, I don't know if I'm gonna have it or not, but it's not a positive, it's not helpful for me. So I don't want to be there. I just want to believe that everything happens to Miriam Gonzalez, and if she gets sick, she's going to be able to navigate through and get well as soon as possible. So that is a positive belief, okay? And also, literature will tell us that if people are connected with others and they have resources and they also have housing and employment and financial stability, that will help a lot to navigate through the disaster without major concerns or problems. So let's try to look for those kind of things, okay? Belief, positive belief, resources, that will help a lot. Okay, let's move to our next session. Okay, so if you see when you get to a disaster field, most of the people that you're going to interview are having our problems. So you need to help them solve problems. So the best motto for you is going to be problem solving, okay? Problem solving may be very difficult under conditions of stress and adversity. What happened? You, as a person, you could have very good skills in problem solving. That doesn't mean that when you are in the right middle of a storm, all your cognitive functions are going to be available for you and you could use the skills that you have. So most people, we need somebody else in that moment of confusion to help them see what are possible alternatives and how to evaluate, okay, the pros and cons of each possible solution. Pick one solution, okay, and make an action plan to try to resolve the problem, the concern, or the need that people may have, okay? So that is very important for you to know, and you usually do problem solving. Let's move to our next slide. Okay, so in this slide, you will have the steps to guide the survivor to the problem solving skills. Okay, number one, identify the most immediate need. And you know what? That's not easy. And I'm going to tell you why. Because they have a lot of need and they will be bringing to you, oh, I need this and I need this and I need that. And they have a lot of needs. So as a provider of PFA, you need to be very good in helping people establish the priority. What is the main concern right now? Okay, where are we going to focus? What is the next step we need right away to make? Okay, and help them in that next step. Okay, number two, clarify the needs. Okay, be practical. I want to feel better. What that means? You don't know what that means. So you need people to be specific in what they really need, okay? Discuss an action plan. You know what? When the earthquake in the south occurred in Puerto Rico in January, I heard a lot of people say, I want to leave Puerto Rico. I want to go to the United States. And I said, Mia, maybe that's an alternative, but that's not the immediate need right now. Right now is that you lost your house and we need to see where you're gonna sleep tonight. So you need to help people, you know, to look for what they really need right away and the action plan they need to do right away. Later, you could have goals and you could manage and work with the goals in the future. But right now, we should keep focused on what is needed now. And the action plan has to be real. You could not say, I want to go to United States, but I don't have no money for the tickets. So maybe that's not real right now. So we need to see what is a more realistic goal at that moment. And that's very important when you're discussing the action plan, okay? And act to address the need. Maybe people will need to fill some papers and they don't know how to do it. So maybe you said, okay, so you need to send that paper to any office. And do you know how to do it? Do you have the address where you should send that solitude to someone? And you may help in that, okay? So be very practical to act to address what the action plan, if they really have the tools to act on that action plan. Okay, very important that. Okay, let's move on to our next slide, please. Okay, our children and adolescents, okay, also have needs, and they also could benefit from problem solving skills. Okay, so you could use them also with children and adolescents. They also need clarification in some of the needs and concerns they have. And with children and adolescents, maybe you will need an adult parent, or maybe an older brother or sister that could help the child in implementing the problem solving plan that you make with them. Okay, so you could gather other people, bring other people, adults that will help the children to assist the children in their plans and follow plans through. Okay, and when appropriate, share the plans with parents and caregiver, involve them in the plan. That would also help. Okay, let's move to our next step. Okay, Dr. Lisa is not here with us, but I believe that in this slide, she was sharing with you resources that you could access, okay, to have them, so you could use them with survivors. Okay, let's move on. Okay, our sixth point is very important, is the connection with social support to help establish brief and ongoing contact with primary support persons and other resources or sources to support, including family members, friends, community, and helping resources. Okay, primary resources could be family or a significant other. Encouraged to use immediate available support persons. Somebody wants to help. I remember in Hurricane Maria that this person lost her house, and some friends told her you could come over. No, but I don't want to bother. Yeah, but if they told you you could go that night, spend that night with them, why not? So let's try to link that person with the resources that are near them in that moment. Okay. In this model, in the manual, you see that they also discuss support seeking and giving. That's very important. Special consideration with children and adolescents, especially in connection. They need friends, peers. They need to play. Even that we are going through a disaster, they need to play. Okay, so that's very important. And how you could be a model and teaching people how they can support other people. So all that information, you will find it in the manual in that section. Let's move on a little bit to talk about what kind, when we're talking about support, what kind of support people may need. Making contact with other, can help reduce feeling of distress. That is why social support is so important. Children and adolescents can benefit from spending some time with similar age peers. People need emotional support. Right here in our bullet, we have hugs. Be careful in COVID-19, not hugs on COVID-19, okay? Because of social distancing. Let's work with social connection. People need to feel that they fit in, that they have things in common with other persons. Feeling needed. Sometimes we like to know that people need us and that we also need others, okay? Sometimes you need reassurance of self-worth. Oh, you're doing great. That was great. Very good decision. You need that kind of stuff, okay? Let's move to our next slide. Sometimes we need reliable support. Maybe somebody, you could put your head on their shoulder and you know that everything is gonna be okay. Sometimes the kind of support you need is advice and information. Right now in the COVID-19 pandemic, a lot of help, careers and financial helps are coming, and people need to know that those resources are available. So they need that kind of information and advice. Sometimes people will need physical assistance, having somebody to come and fix something broken in the room or in the house, or helping you with paperwork, that would be great. Material assistance, sometimes people may need clothes, food, money, and that's the kind of support they may need in that moment. So it's important that when you talk about support with people, you let them know all those kind of support, and they could address or identify what they aren't needing in terms of support. Okay, let's keep on. I think let's go to the next one. Children, next one, please. Okay, children, very important. Bring similar age children together. If there's an earthquake, usually people will go to the field and make some activities with children, play with them, okay? Art, draw, activities for children are very important. Some providers have very good abilities to work with children. You may say, as a provider, I don't have too much skills working with children. So you decide if you have very good skills with children, adolescents, great for you. Go for them, help them. If you're not so good, let other people do it. Okay, no problem with that. Let's move on to our next slide. Okay, we might think that everybody that is in after a disaster may be looking for help, but that's not true. A lot of people are reluctant to seek support. Why? Okay, there's very reason, not knowing what they need. Incredible but true. Many people don't know what they really need. Other people will feel embarrassed or weak because of needing. So even though they need, they will not say or talk about what they really need, okay? Feeling guilty about receiving help when others are in greater need. I saw that a lot in the earthquake in January. Others need more than me. Don't give me that. Other person, give it to another person. Okay, I saw that even in elderly population. I saw it a lot. I thought, not knowing where to turn for help. Yes, I need help, but I don't know where to go to find the help that I need. You could find that also. Okay, worrying that they will be a burden or depress others. Usually a burden. I see a lot of people that I try to connect with others, but they didn't want to because they feel they were a burden in people's life and they don't want to feel that way. Okay, doubting that support will be available. Here in Puerto Rico, now with COVID-19, they say, oh, financial help is coming for you, and people will sit down and say, I don't trust that. I don't believe it. They don't really believe that the financial help was coming, okay? And thinking no one can understand what I'm going through. So that kind of thoughts will not lead people to seek help, okay? So you may find some of those obstacles and you have to work with them, so people then open themselves to look for the support they need. Okay, let's move on. Okay, I think some of the slides you just could read it and you could have the information. Withdraw social isolated survivor. Okay, think about the type of support that would be most helpful for them. Think about whom they can approach for the type of support they need. Choose the right time and place to approach the person. Sometimes you want the support right now, but it's not right now. It's going to be maybe next hour. Okay. Talk to the person and explain how she or he can be helped, and afterwards thank the person for his or her time and help. That's always very important. Let's move to our next slide, please. Some people want to provide support. That is great. But you know what? My first concern is that you need to work with yourself. You need to address your emotional issues. I saw in Maria, and I also saw it in the earthquake, that a lot of people need a lot and they forgot about their own needs and they went over there to help others. So I think it's very important to say, yeah, it's very nice to help others, but you also need to take care of your own needs. Keep that in mind, okay? And you could read the rest of the bullets in that slide, okay? Let's move on. We have there a cultural alert. I will go over that. Okay, let's go to our next. Okay, information and coping. You know, this session, information and coping, we could have the 3 hours of the seminar only in this session. That's a lot of information for you in the manual. My objective in this session of the webinar is just to let you know what kind of information is available for you in the manual, so you could look and read and have the handouts for you, okay? So what you will find in the manual is information about stress reaction. You will find review common psychological reactions to traumatic events that are very common, okay? How deal with experiences of losses, talking with children about body and emotional reactions, provide basic ways of information, coping mechanisms, okay? Good coping mechanisms and maladaptive coping mechanisms. We'll find both, okay? And teach people how to relax and breathe. You will also have the instructions in the manual how to teach and guide your survivor through these skills. Okay, let's move forward, please. You will also have in your manual how to assist with developmental issues, how to assist with anger management, very good information about anger management, how to deal with negative emotions. If people are having sleeping problems or difficulties, you will find in the manual tools and steps to deal with sleeping problems and how to address alcohol and substance abuse. Also, you will find it in the manual, okay? So let's keep moving to our next slide, please. Various types of information can help survivor manage their stress reaction. So it's important to find the right information, as I said before, okay? Be updated, to help them know what is being done to help them. It's very, very important to let them know where to go for services they need, okay? And to learn how to manage post disaster reactions. Always is very useful to give self-care tools to our survivors. Okay, let's go on. We have now in our next slide poll question. I'm not going over because we had a limit of time, but some stress reactions experienced in our population to COVID-19 are A, stress, anxiety, intrusive ideas that they had spread to the virus, or they spread virus to another person, interpersonal relationship conflict, use alcohol and drugs increase, and the answer is all the above, okay? So let's move on, okay? Then in the manual, you will find this handout when will you have information about different domain, cognitive, emotional, social, and psychological. What are possible negative coping mechanisms people are using or negative reactions they are having, as for example, in cognitive domain, confusion, disorientation, worry, intrusive thoughts, and image and self-blame. And we want to move them to the column that is positive responses, okay? So you could see emotional, they could be in shock, sorrow, grief, sadness, fear, anger, numbness, irritability, guilt, and shame. And we want to move them to feel involved, challenged, mobilized. We could be in the social domain, seeing people withdraw or with a lot of interpersonal conflict. Right now, the lockdown has brought a lot of interpersonal conflict, and we need to help them how to work that out, okay? And also, I said the somatization was there, so some of them are having headaches and they're having tension, and we need to also respond to help them normalize those physical symptoms, okay? So let's move on, please. And in the manual, you will find, I'm going in each one of the just mentioned steps, okay? There are 3 post-traumatic stress reactions, intrusive reactions, usually like flashbacks, like going back to the scene and hearing the noise of the earthquake or the wind in the hurricane. All those kind of reactions are very common, normal reactions. We expect them in disasters survivors. Some of them are having avoidance or withdrawal reactions. They don't want to pass through the bridge. They don't want to talk to the neighbor because it was the person that was with them during the earthquake, and that brings reminders to them of the earthquake situation. So the kind of behaviors, we could see them as a response to disaster, or physical reactions, a lot of breathing problems or heart beating or irritability, or you could also see difficulty with concentration, with attention, and we have to work that out, okay? Usually with calm routines that will do much better, breathing exercise that would help a lot, relaxation exercise that will help a lot our survivors, okay? So let's keep on. Another, next slide, please. Another reactions are grief reactions, traumatic grief reactions, depression, physical reactions, I said before, okay? You would have in your manual all the information related with grief reactions. And as I said before, remember, it's not only about death, people dying. It's about the secondary losses people have right now with COVID-19, job, school, routine, being able to hug the people they love, okay? All those kind of losses are important to be addressed also in this pandemic, okay? Let's move to our next slide, okay? Traumatic grief reactions right now are very difficult in the pandemic of COVID-19. People are dying. Some people could not, were in, the loved one was in the hospital. They could not see them. They could not talk with them. They could not say goodbye to the loved ones, okay? So that is a very difficult situation. So sometimes we need to help them how to do what they're going to do with the funerals, how they're going to work out with that kind of stuff. What is if they have religious belief, how they could get in link them with leader of their religious community to help them go to the what they believe should be how they should deal with the death of a loved one. Okay, that could help also. So you have all that information in the manual. You could read it. It's there for you. Okay. Some, next slide, please. Other things that some people, not most of them, but some of them will have is depression associated with a prolonged grief reactions to all the losses maybe that they have been going through the disaster. Reactions may include feeling tired, feeling hopelessness, worthlessness, guilt, difficulties in sleeping, loss of appetite, irritable mood also could be signs of depression. Remember, as I said before, more than 2 weeks, or if that depression is making interference with their functioning, with their roles, and then you should, okay, make a referral to a mental health practitioner that could help the survivors to deal with this situation, okay? Physical reactions, I said before, without dizziness. Next slide, please. And they could, as I said, even in the absence of any underlying physical injury or illness, people could have these physical reactions or problems, okay? We could normalize that. Yeah, you're gonna start sleeping. Oh, that's normal. The first day that you could not sleep so well after the hurricane or after the disaster. Okay, I think right now in Puerto Rico, we're having a lot of reminders. In the south right now, there has been little earthquakes today, and we have a lot of rain, and there's a lot of wind. So I believe that right now is a very difficult moment for a lot of people here in Puerto Rico because they should be having reminders, okay, of what they live in through the Maria hurricane and what they live in through the earthquake and a lot of stresses right now going on, okay? So we could find that in our population. Okay, let's move right away. So I think the one of the points that I really want to make clear is about coping mechanisms. People who show up maladaptive coping actions or very good coping mechanisms. What we really want to do as a provider of PFA, we want to help people to implement good coping mechanisms. What are maybe maladaptive coping mechanisms? I feel so bad. I feel so sad. I'm going to withdraw from my family and from friends. No good. That's no good for the person, okay? Working too many hours during the pandemic is a way of not thinking or not feeling, but you need to think and you need to feel also. So it's not so good, and you need to have rest time, because if not, you know you could get physical problems also. Getting violent or angry doesn't resolve the problem. That will bring more problems to their lives, okay? Excessive blaming self or others. It is what it is. Act therapy said that we need to not resist and accept. And I think that's very important. Withdraw from activities. One of the main recommendations when you're going through pandemics or disaster, if you could maintain your routine, you should do it. Try not to destroy the routine. When I was in COVID-19 and when I was doing telepsychology with my clients, and I said, are you going to sleep at the hour that you usually did before? No, bad idea. I'm eating junk food. Oh, bad idea. You know, try to keep people doing the healthy things that they used to do before the pandemic. Very important. When the anxiety comes, overeating and under eating could be things that we could see in our population, and we need to help them to get back to the good and healthy diet. Okay, watching too much TV, being too much in television, watching all these news could put people more with more anxiety and worry. So we need to limit sometimes the time we spend looking to television, okay? Important always not do risky behaviors, okay? That's, I said before, with adolescents, you have to take care of that, okay? And always remember, if you don't take care of yourself, that's no good. You need to take care of you. And you also need to be very mindful in the use of alcohol if you're using alcohol or any kind of drugs. So let's move to our next slide, please. So in your intervention with survivors, we want you to discuss positive and negative forms of coping. You could address what is a maladaptive coping mechanism and what is a positive coping mechanism. So let's help people differentiate them, okay? Identify and acknowledge their personal coping strength. That's very, very important, and we want to do that, okay? Think through the negative consequence of maladaptive coping actions. You could drink alcohol and then you went violent, and then there was a maybe domestic violence incident at home. That's no good. That's not what you want in your life. So help them to see that later on they will have more difficulties if they are using maladaptive coping mechanism, okay? And encourage survivors to make conscious, goal-oriented choices about how to cope with the stress they are going on. Let's move to our next slide, okay? So in the next slide, please. In your intervention, you could provide information in ways of people could cope healthy, okay? Talking to another person is a very good coping mechanism. Getting needed information, getting adequate rest, nutrition, and exercise, engaging in positive or distracting activities, sports, hobbies, reading, trying to maintain a normal schedule. I remember Maria, somebody told me that she wants to go to the beach, but her whole family was saying, how do you dare go to the beach when there's so many people suffering in Puerto Rico? And she said, yeah, I'm suffering also, but I think I need to go to the beach. And that's okay. Go to the beach. You need it. That will help you. There's no problem. Go to the beach, okay? So those kind of things we want to encourage people to do. Okay, sometimes you need to tell yourself that it's okay to be upset. It's a very difficult time, you know? Be compassionate with yourself. That's important, very important. A schedule. Schedule for me is a very good tool, and you have to schedule also pleasure activities, okay? Eating healthful meal, spending times with other, participating in support groups, right? Right now, virtually NA and AA are having meetings. And when people are having substance abuse problems, I encourage them to go to the meetings. Okay, that's very important. And also I usually say to my people, 5 minutes of breathing exercise. That would be great. Just try to do 5 minutes. Stretch yourself if you're sitting too much. Okay, right now we've been 2 hours. Stretch yourself. Okay, do some stretching exercise. That would also help a lot. Okay, so in the manual, I know we don't have too much time, we're over the time, but you could also find all the recommendations, how to work with anger management, okay? You have there that one, all those things. You also, and in the presentation, the slide, you also have, could you go over the slide, please? How to deal also with the other one, please, next one. Next one, next one. How to deal with sleeping difficulties. Next one. There you go. Okay. That is very common. The people and the children are going to have sleeping difficulties, and you will have in the manual one-to-one all the recommendations, how you will help survivor deal with that kind of difficulties. Okay. You will also find how to orient people that are having substance or alcohol abuse. So everything is in the manual and in the handouts, okay? So our 8th section was or is to link with collaborative service. I think I don't need to talk more about that because during the whole presentation, I've been talking about the importance to link people to the service they need. So that is very important. Also, I don't want to finish. I want 3 more minutes just to let you know that if you are a provider, you also need to take care of yourself, okay? Working in disaster, working with people that are suffering is very hard, okay? It takes a lot of energy also. So you need to take care of yourself. Sometimes you need to assess yourself if you're ready to support others. I remember when Maria came over, I had a very big challenge in my life. My mom had a cancer and she has to go to surgery. So a lot of people was calling me so I could go to help others during the hurricane, and I said, no, I can't. I have too much stress right now, and I think my priority is my mother. She's in the hospital and I have to be with her. So you need to know when you can help and when you cannot help, and it's okay with that. Okay, take care of yourself. You cannot be given FDA or providing FDA services when you haven't sleep. You also need to sleep. If you're providing services, you also need to eat. Okay, so take care of yourself. Have other friends and people you could talk a little bit, okay, of your experiences and debrief a little bit what you're seeing in the disaster. Sometimes you'll see very difficult situations and you need to take care of yourself. So everything is in the manual, really. My desire is that you could have that we navigate very rapidly through the manual and that you know what information you could look for in the manual. So right now, I would like to see if you have any questions that I could answer for you. It would be a pleasure for me. Do we have any questions around?
So far, we don't have any questions. No, it
No?
seems that no, we don't have any. So it seems like everything was well understood, but I would encourage our participants that if you do come up with some questions, you may contact us and let us know if there's some information that you might need, and we'll be happy to provide that for you. So on behalf of the National Hispanic and Latino Mental Health CTC, I would like to thank you for your presentation, Dr. Gonzalez, and Dr. Velez as well. I know she had, and I apologize, as you know, we have a storm coming, and one of the results of that is that many people in the island are losing their power, so she was one of them. I think we might have a question. It's just thank you for your presentation. So I would like to remind our participants to please fill out our evaluation form. As you leave today's webinar, you'll be redirected to complete a brief survey, and this is important for us as it allows us to continue the work that we do. It allows us to continue to offer webinars and virtual training, so please take a few minutes to complete the survey. So thank you everybody for participating. We appreciate you taking the time to connect with us. Thank you.
Thank you to everyone. Bye.
Bye.
Bye.